Winters are here and so the incidence of bad cough have increased. Hello everyone, I am Dr. Tanvi Mahant, founder and owner of HomeoHeals Clinic, and welcome back to my channel HomeoHeals. So in this video I am going to discuss about few homeopathic medicines which I use in my practice frequently for this bad winter cough. So this video is only for information purpose and for few homeopathic practitioners to help them. Before consuming any homeopathic medicine, do consult your homeopathic doctor. And if you're new to my channel, do not forget to subscribe to my channel and press the bell icon so that you will get notification on my upcoming videos. So every year in this winter season, we see a lot of patients coming up, children coming up with this bad cough, and which is troublesome and it is not settling in spite of taking many other medicines. So let's start directly with few homeopathic medicines. So first medicine I'm going to talk is about Aconite. Now Aconite I have been using very frequently in my clinic in this season. Mostly it is a very good remedy where the cough starts after exposure to cold winds. So typically I've seen patients giving history that they had gone to beach side and where there is exposure to dry cold winds, and next day they start off with this bad dry barking cough, and sometimes it is also associated with fever. So in such cases think of Aconite. Then the second remedy is Cocos cacti. So I have used this remedy even today in my clinic. So typically this remedy, if you see, the important indication is that again the cough is very dry cough and the patient has a lot of irritation in the throat, and this is specifically for doctors. If you examine the throat, you will see that the uvula is elongated and you will see a lot of congestion and a lot of mucus secretions around your soft palate. So if you see this on examination, and if you have symptoms of irritation in the throat and cough, think of giving Cocos cacti. You will see excellent result. The next remedy which helps me a lot is Hepatic sulf. It is an excellent remedy where the patient develops cough and also hoarseness of voice, sometimes loss of voice after exposure to cold air, cold wind. And the patient is extremely chilly, slightest air, or even he is almost covered up, he will come to your clinic where he is wearing sweaters, and if there is slight exposure to cold air in any part of the body which brings on the cough. Another classical symptom of Hepatic sulf is obviously again there is a sensation as if something is stuck in the throat. Right, there's fishbone like sensation which is characteristic of Hepatic sulf. Here it comes very close to nitric acid, which is also a very good remedy where you can think in this season for cough. Then another good remedy which I use is Rumex. I recollect a patient which I had seen few days back. She had a very dry cough which was fatiguing. She was almost tired, and this she had for almost 1 week, and she was not responding to other treatment. So this dry cough which in this season, and when she was sitting, initially I had a wall fan in my clinic. So whenever that air from the blow from the fan was coming on her face, she started with this cough which used to aggravate. So cough which is aggravated by inspiring cold air is very characteristic of Rumex. Another very characteristic symptom, again they have a raw sensation in their throat or in larynx. So again Rumex is an excellent remedy for such patients. Then cough, in Rumex also the cough is also aggravated by lying down. Another remedy which I use many times is Drosera. So Drosera, the very characteristic indication is cough as soon as the head touches the pillow. So whenever the patient says that the cough is more at night, you should ask as soon as the patient lies down, if the cough starts, think of giving Drosera. Also Drosera, the patient will retch, there's a lot of retching. So he will say that from abdomen, the cough is so powerful that he's constantly retching and then he's coughing. So think of Drosera. Also, creosote is a good remedy to use for cough in old people in winter season. And also there is pain in chest, and if you have an old patient coming up with a bad cough, think of creosote. We can also think of anti-miasmatic remedy if patients are not responding to this indicated remedy. So rhinum is a very good choice to use in this winter season as a remedy. You can also think of tuberculinum. There are many more remedies to talk about. This is in short about few remedies and few indications which I see in practice while prescribing. So if you want to write down any remedy which you have used in your practice in winter season specifically for cough, do write down in the comment section. And I hope this video was helpful to you, informative to you. If you find it helpful, kindly like the video and do not forget to subscribe to my channel. See you soon in my next video. Thank you.